Anybody who's doing research and speaking out, no matter what your topic is, the guys at Stanford, USC, they're getting attacked, they're getting vilified, and they're saying, we have degrees in this field, we're doing research, and people are acting like I'm some yahoo, doing experiments in my garage. So people are attacking us based on their political ideology, because if you come at me with facts, I've got lots of data now from epidemiologists and from biostatisticians that are really sort of standing behind the kind of ideas we set forth. And I don't know that it's about facts anymore, because I think the facts really speak for themselves. The different stations were parked outside my building, and they would periodically say, "Hey, what do your numbers look like?" So I said, well, I called the press conference and I said, the three major networks, I said, why don't we get together? I said, I'm just going to present what I'm seeing. It's an opinion-based piece. So I said we had done 5,213 tests. We had done 340 positives. This is a PCR test. It's a nasal swab. It's a yes or no. It does not test immunity. So basically just saying, I think there's a lot more out there. We won't know until this whole thing is through. And then, I think people really took it the wrong way. I was trying to give a small community of 900,000 people a sense of what's going on. So I said the hospitals have ICU beds. We have surge capacity. We're ready for this. So I wanted the community to know we're ready. We've only seen 340 positives out of thousands and thousands. I want people to know it's prevalent, but the hospitals and the real sick people, we're not seeing a lot of that. So I was trying to give a basic overview so people understood what's happening in Kern County, and I chose to do it through that media. Had no idea that it would get sent out, did not anticipate that at all. So I think we have to be real clear on what we're reporting. And some of the reports from the coroners out of New York are reporting every single patient coming in with a COVID diagnosis. That is not the most accurate way to do it. And so I'm just basically being a messenger from what I'm hearing around the country and saying, it's important that we know this is widespread and that a lot of people, they call them asymptomatic carriers. That's just a healthy person who's developing immunity to this. And a lot of people have had it, are immune to it. And we haven't, the serology test that's been developed about 2 weeks ago, we just started it in my area. It's a blood test, and it tests for IgG. The IgG immunoglobulin peaks at 5 to 7 days per the MD PhD immunologist that I spent an hour with, who I won't mention because he asked me not to. And so he said, we'll know more as we do more testing. We'll be able to see that a lot of people are indeed immune and had little to no symptomatology. So I wanted people to understand 95% of people pretty much get over this and do really well with it. Usually when the community gets 60 to 80%, is what the epidemiologists have told me, the virus burns out. So the vaccine helps us get to a position of herd immunity where the virus burns out quicker. That's the benefit of the vaccine. If you don't have the vaccine, then it's spread person to person. It gets to a level where it doesn't have enough people to jump to and it dies out. So when you flatten the curve, you essentially lengthen the disease cycle. And we haven't really done this before. So the epidemiologists are telling me we could get a secondary spike. The virus doesn't care if you're hiding. The virus will get herd immunity no matter what we do. And the epidemiologist, Dr. Gisecki, infectious disease, world renowned, has said, I don't think it's going to matter much. If it's not going to matter much whether we sheltered in place, should we be destroying the economy and dropping $2 to $4 trillion? Is the collateral damage indeed worse than the virus itself? Economic collapse affects every single soul. A lot of us aren't getting paychecks. A lot of us are laid off, furloughed, out of work. COVID affects some people. The collateral damage of the economy affects all souls in the economy.